When it comes to medical liability laws and culture, where you live and practice does make a difference. But what is the best state to practice medicine in? And what states should you avoid? Today, we're going to talk about malpractice insurance environments all across the United States, and we'll give you 5 key things to consider as you're looking for a place to work or potential states to expand your practice into. And by the end of this episode, you'll be equipped to navigate the malpractice landscape across America with confidence. Welcome to Malpractice Insights, the show dedicated to helping healthcare professionals understand medical malpractice insurance and providing you with the solutions you need so that you can get back to the work of practicing good medicine. My name is Jennifer Wiggins, CEO of Aegis Malpractice Solutions, and I'm so glad you've joined us today. If you're new to our channel, welcome. Thanks so much for being here. We release a new episode every week, both on YouTube and your favorite podcast streaming platform, so be sure to like and subscribe to stay connected. All right, let's jump in. In the past few decades, many states have passed medical malpractice tort reform. The goal of this tort reform is to reduce malpractice costs, increase access to quality coverage, improve the overall legal environment, and to ensure that patients who are injured by medical negligence are fairly compensated. In an ideal world, frivolous lawsuits are minimal, and the cases with true merit are identified quickly and handled responsibly. This helps to reduce stress, keep malpractice costs at a reasonable amount, allowing doctors to carry the appropriate amount of coverage, and it also makes sure that victims are compensated fairly and in a timely manner. So, what states are best? The states with the best malpractice environment, meaning the most doctor-friendly, generally fall into one of 3 categories. They're either states with malpractice caps, states that have passed meaningful tort reform, or states that have the right culture. There have been many articles published with rankings of states based on the cost of living, average salaries, malpractice costs, etc. But looking at the country purely from a medical liability perspective, the best states to practice medicine in are those with malpractice caps or those that have passed meaningful tort reform. Alaska, Colorado, Indiana, Kansas, Texas, North Carolina, North Dakota, and South Dakota have all enacted reasonable malpractice caps, which sets a ceiling on the amount of money that can be recovered in a case. In these states, litigation has decreased, premiums remain relatively low, and malpractice payouts tend to be overall less than in other areas. More than half of the states in America have passed some sort of tort reform, so the list of good states does go beyond the ones that I've mentioned here. But it may take several years before some of the reform really has an impact in some of these areas. Ohio, for example, has made some real strides in tort reform, but experience hasn't really changed much. So time will tell how effective some of the most recent tort reform initiatives are in Ohio and also some other states. But beyond tort reform and malpractice caps, generally the best states to practice medicine in are those that have the right culture. For example, Minnesota has not passed any tort reform, and yet they have some of the lowest premiums in the country. Some say that the Minnesota nice culture and the tendency to not sue actually supersedes any cap or tort reform initiative. It's just not who they are. The same could be said of Montana, Wyoming, Idaho, Wisconsin, Iowa, Nebraska, and the other states throughout the Great Plains and the Midwest. In general, that entire region performs very well from a malpractice claim perspective. So, which states should you stay away from? Well, it's hard to tell a physician not to practice somewhere because quality healthcare is important everywhere in the United States. That being said, Some states are generally more litigious, and physicians practicing in those areas will likely pay much more for their malpractice insurance. It doesn't mean you shouldn't work there. It just means that you should be prepared to pay more and possibly get sued more. Florida, New York, Washington, D.C., parts of Pennsylvania, New Jersey, and Delaware generally experience more litigation. They have some of the highest malpractice payouts in the country, and malpractice premiums can be very expensive. Even in some states where the overall environment is stable, major metropolitan areas always seem to be a hotbed for litigation. For example, Miami, Florida, Chicago, Illinois, New York City, New York, Detroit, Michigan, Los Angeles, California, Las Vegas, Nevada are usually the most expensive places to practice within their given regions. If you are considering adding an additional location to your practice, make sure you do your research before jumping in and signing any contracts. Now that telemedicine is a common part of modern healthcare, it's important that you consider how treating patients in a new geographic location might affect your overall risk. Adding additional practice locations may seem like a simple change, but there are risks and costs to consider regarding your medical malpractice insurance. So, here are 5 key things for you to consider before you expand into a new area. Number 1, what is the overall malpractice environment like in this new location? Are you dipping your toe into a higher risk pool? Number 2, is your current malpractice coverage sufficient? Are your limits adequate? Number 3, will this increase your premium? Number 4, are there other future coverage concerns that you should be aware of? If you start working and then change your mind, how does that affect your coverage? Will you have to buy tail if you pull out of a state after practicing there for a while? And number 5, will your current employer allow you to work in this new location? Will your malpractice carrier even approve it? Healthy malpractice environments have many obvious advantages: lower premiums, fewer frivolous cases, and prompt, responsible handling of true negligence events. But have you considered the downstream effects of meaningful tort reform and healthy malpractice climates in a state? Consider this. Healthcare providers practicing in doctor-friendly states tend to have improved quality of life as a result of decreased litigation stress, more money in their pockets, heightened morale, and the ability to practice good medicine without being defensive and costing their patients more money. Healthy malpractice climates also improve patient safety, as medical practices and hospitals have an easier time recruiting and retaining doctors, which in turn equals greater access to quality healthcare, especially for those performing high-risk procedures. So, which city or state is right for you? Still not sure? Talk to a knowledgeable malpractice insurance agent like us to better understand the area where you're interested in practicing and learn about the coverage options, policy types, rates, and carriers that are available to you. If you have any questions on this topic or you want to make sure that you're covered appropriately, click the link in the description box below where you can connect with us via phone, email, or chat today. And if you're listening, please visit us online at aegismalpractice.com. That's AEGIS malpractice.com. We have some great episodes lined up for you in the next few weeks. I hope you found this one helpful. If so, could you do me a favor and give us a like and leave us a review? And be sure to subscribe to our show so that you can catch our next installment of Malpractice Insights, where we're dedicated to helping you understand medical malpractice insurance and providing you with the solutions you need so that you can get back to the work of practicing good medicine. This is Jennifer Wiggins. Thanks for joining us.